Welcome to your personalized deep dive.
Mm-hmm.
Today, we're exploring a potential game changer
Oh, wow.
for those dealing with advanced Parkinson's disease.
Okay.
Imagine a treatment that could give you back hours of your day, those precious hours lost to the debilitating off periods that come with Parkinson's.
Right.
That's what we're digging into today, a treatment called
Yeah.
Levodopa-Carbidopa Intestinal Gel, LCIG for short,
Okay.
or Duodopa if you go by the brand name.
All right.
We've got a fascinating document here, a decision aid designed for patients and families in Canada,
Yeah.
which gives us a really unique perspective.
What's striking about this document is its focus on the human element.
Right.
It doesn't just throw facts and figures at you.
Yeah.
It acknowledges the very real challenges faced by those with advanced Parkinson's and their families.
Mm-hmm.
It recognizes that making a decision about a treatment like this
Yeah.
is a deeply personal one with no easy answer.
Exactly. It's not just about the science.
Yeah.
It's about how this treatment could actually impact your life, your day-to-day experiences.
Yeah.
So how does this whole thing work?
LCIG is basically a gel form of two medications, levodopa and carbidopa,
Okay.
that are commonly used to treat Parkinson's symptoms.
Mhm.
But what sets it apart is how it's delivered. Instead of relying on pills,
Yeah.
which can lead to those unpredictable off periods as the medication wears off,
Mm-hmm.
LCIG is delivered directly to the small intestine
Right.
through a pump and a surgically implanted tube.
A surgically implanted tube.
Yes.
That sounds pretty intense.
It is, but it's a minimally invasive procedure.
Okay.
And the tube, called a gastrovaginal tube, is designed to be long-lasting.
Okay.
The source material highlights that while there can be complications like any surgical procedure,
Right.
the majority of people adapt. Well,
Okay.
it does require daily care, and there's a learning curve involved.
Yeah.
But the payoff can be significant.
Okay, so we're talking about a more consistent delivery of medication,
Yeah.
which could potentially mean fewer off periods.
Exactly.
But how much of a difference are we talking about here?
Well,
Are we talking about minutes, hours, or what?
studies have shown that people using LCIG experience a significant reduction in off time
Okay.
by an average of 4 hours per day.
Wow.
And that's not all.
Okay.
They also see an increase in on time,
Mm-hmm.
the periods when symptoms are well controlled
Right.
without experiencing dyskinesia, which are the uncontrolled movements that can be a side effect of levodopa.
Wow, 4 hours a day, that's huge.
It is.
That's like getting a whole chunk of your life back.
Yeah.
To do the things you enjoy.
Right.
Time to feel more like yourself.
Precisely. And it's not just about quantity.
Yeah.
It's about quality. Imagine having the energy and motivation to engage in activities that
Right.
might have felt impossible before.
Mm.
Think about the potential impact on your mood, your relationships, your overall sense of well-being.
That's a powerful thought.
Yeah,
But let's be realistic. No treatment is without its downsides.
of course.
What are the challenges that come with using LCIG?
You're right. It's important to consider the full picture.
Mm-hmm.
The most common side effects reported are abdominal pain,
Okay.
some skin issues around the tube site,
Yeah.
and the possibility of complications like tube dislodgement or infection.
Okay, that does make me a bit hesitant.
Sure.
How common are these complications?
It's understandable to be concerned.
Yeah.
However, most of these side effects are manageable and tend to occur mainly within the first few weeks after the tube is placed.
Okay.
And while tube dislodgement might sound scary,
Right.
the source material indicates that only about 9 out of 100 people need their tube replaced within the first year.
9 out of 100. That puts it into perspective a bit more.
It does.
But what about the everyday reality of living with LCIG?
Right.
You've got a pump, a tube. It all sounds pretty complex.
Yeah.
What adjustments might someone need to make to their lifestyle?
There are definitely practical aspects to consider. You'll need to carry the pump, which some people find bulky.
Okay.
And there's the daily routine of tube care, including rinsing it to prevent blockages.
Mhm.
Some individuals also express concerns about feeling self-conscious about the device.
I can see how that would be a concern.
Yeah.
It's not just the physical aspect,
Right.
but the emotional and social impact, too.
Yeah.
It would be fascinating to hear from actual patients and caregivers about their experiences.
It would.
What insights does the document offer in that regard?
You're spot on. The document includes some really insightful quotes from people who are living with LCIG,
Okay.
and their perspectives are invaluable.
All right, let's hear what they have to say. I'm really
Yeah.
curious to get their take on the pros and cons.
Great. One patient describes the feeling of being always on after starting the pump each morning.
Always on.
Yeah.
That's a powerful image. It makes you realize how much of a burden those off periods can be.
Right.
Not just physically, but mentally and emotionally as well.
Absolutely. This patient also appreciates not having to worry about timing meals or medication absorption.
So there's a sense of freedom that comes with that consistent medication delivery.
Yeah.
A sense of control over your day.
Right.
But we also have to remember those concerns about the pump's visibility
Yeah.
and the potential self-consciousness. Did the patient address that?
They did mention feeling frustrated with the pump's size and weight and
Okay.
the difficulty of finding clothes that conceal it.
Yeah.
They also talked about the need to constantly be aware of the device.
It's a good reminder that even with the potential benefits,
Right.
there's a real adjustment period,
Yeah.
both physically and emotionally.
Yeah.
It's not just about the device itself. It's about how it fits into your life,
Exactly.
your self-image, your sense of normalcy.
And that's why it's so important to have realistic expectations and to be prepared for the challenges that might come up.
What about the caregiver's perspective?
Yeah.
What insights did they offer?
The caregiver in the document observed some really positive changes in their loved one after starting LCIG.
Okay.
They saw significant improvements in their mobility and independence,
Mm-hmm.
which led to them being able to engage in more shared activities and having a less stressful caregiving experience.
Right.
They also spoke about the relief of not having to constantly monitor medication schedules and worry about missed doses.
It sounds like LCIG can have a positive ripple effect, not just on the person using it, but also on their loved ones and their support network.
It does.
But it's not without its initial hurdles.
Right.
The caregiver mentioned feeling anxious about managing the pump and the learning curve involved in daily care.
Yeah.
So there's a shared responsibility there.
There is.
A need for both the patient and the caregiver to adapt and learn together.
Yes.
Did the caregiver mention anything else that stood out to them?
They actually highlighted a really important point, the lack of awareness about LCIG in healthcare settings. This emphasizes the need for patient advocacy and education to ensure proper support and understanding.
That's a crucial point. It's not just about the treatment itself.
Right.
It's about having access to the right information,
Yes.
the right support,
Yeah.
the right network of healthcare professionals who understand this treatment.
Absolutely. It's a collaborative effort involving the patient, the caregiver, and the healthcare team.
We've covered a lot of ground here.
We have.
The science behind LCIG, the potential benefits, the challenges,
Mm.
and the real-life experiences of patients and caregivers. It's a lot to consider.
It certainly is, and that's why the decision-making process is so crucial.
So where do we go from here? How can our listener use this information to make an informed decision about LCIG?
The key is to reflect on your personal values and priorities.
Okay.
What matters most to you? Independence, symptom control, quality of life, the willingness to adapt to lifestyle changes.
Yeah.
These are all factors to weigh carefully.
And the source material really stresses the importance of shared decision-making.
It does.
It's not just about what the doctor recommends.
Right.
It's about a collaborative conversation between the patient, their family, and their healthcare providers.
Right. And there's even a tool included in the document called the SURE test.
Oh, wow.
It helps patients assess their understanding of the risks and benefits of LCIG and their comfort level with the decision. It prompts them to ask themselves,
Okay.
am I sure about the medical information?
Okay.
Do I understand the benefits and risks? Do I feel encouraged to ask questions and discuss my concerns?
Right?
And am I sure this is the right choice for me?
That's incredibly valuable. This deep dive has provided a lot of information.
It has.
But ultimately, the decision about whether or not to pursue LCIG is a personal one.
Exactly. And it's a decision that should be made with a clear understanding of the potential benefits, the challenges, and what matters most to the individual. We'll delve deeper into some of those personal considerations in the next part of our deep dive.
We've talked a lot about the potential benefits and challenges of LCIG, but I'm curious to dive a little deeper into what life with this treatment actually looks like.
Okay.
Can you walk us through a typical day for someone using LCIG?
Absolutely. The source material outlines a daily routine that might sound a bit daunting at first,
Okay.
but it becomes second nature over time. Imagine this. You wake up in the morning, and the first thing you do is prepare your LCIG pump. You disconnect it from the intestinal tube, which, remember, was surgically implanted, and rinse the tube with water using a syringe.
Right.
This ensures it's clear and ready for the day's medication.
So it's like a little morning ritual, a bit like brushing your teeth, but for your LTIG tube.
Exactly. Then you attach a new cassette filled with medication to the pump.
Okay.
And connect the cassette's tube to the gastrojejunal tube.
Right.
You deliver a pre-programmed morning dose with a simple press of a button. And the pump takes over automatically, switching to continuous delivery mode.
That sounds pretty straightforward.
Yeah.
I was imagining a much more complex process.
Yeah.
Involving constant monitoring and adjustments.
That's a common misconception. Once the medication starts working, usually within about 15 to 20 minutes, you're good to go.
Right.
You can engage in your daily activities from work to hobbies to exercise, all while the pump discreetly delivers medication. You can wear it in a vest, on a belt, or even in a shoulder bag.
So you're not tethered to a machine or anything?
Yeah.
It seems like it offers a lot of flexibility.
It does.
But what happens if you need to shower or swim? Do you have to disconnect the pump completely?
That's the beauty of it. You can temporarily disconnect the pump for those activities.
Okay.
It's designed to fit seamlessly into your life, not disrupt it.
That's reassuring.
Yeah.
It makes the idea of living with LCIG seem a lot more manageable.
Good.
But what about those times when symptoms break through, those dreaded off periods? Can you do anything about that, even with a continuous delivery?
That's where the bolus dose comes in.
Okay.
Think of it as your secret weapon against those breakthrough symptoms. If you start feeling those familiar off-period sensations creeping in, you can administer an extra dose of medication throughout the day.
Ah, so you've got that backup just in case. That must provide a sense of security.
It does.
Knowing you're not entirely at the mercy of the pre-programmed dosage.
Exactly. It gives you a greater sense of control over your symptoms.
Okay.
Now, we've talked about the daytime routine,
Yeah.
but what about nighttime? Do you have to sleep hooked up to the pump?
That was actually one of my questions. It seems like it would be pretty uncomfortable to sleep with a pump and a tube attached.
It depends on individual needs and preferences.
Okay.
Most people use the pump for about 16 hours a day, which covers the majority of their waking hours.
Right.
But for those who experience significant nighttime symptoms, like trouble sleeping or restless legs, there's the option to use the pump for up to 24 hours.
Wow.
It involves a slightly different pump setup and programming.
Okay.
But it can be a real game changer for those struggling with nighttime symptoms.
So there's flexibility built in for those who need that extra support throughout the night.
There is.
But what about the long-term maintenance?
Okay.
How often do you have to replace the pump, the tubing, all that stuff?
The gastrojejunal tube itself is designed to be quite durable, lasting for up to 5 years with proper care.
Wow. Okay.
However, it can be replaced sooner if needed. The frequency of replacement is best discussed with your healthcare provider, as it varies based on individual circumstances.
Okay.
As for the pump and other supplies, those are typically replaced on a regular schedule determined by your medical team.
That makes sense. It's good to know that you're not constantly having to worry about equipment failures or replacements.
Right.
But let's shift gears a bit and talk about the bigger picture. We focused a lot on the practicalities, but what about the impact of LCIG on people's lives beyond just the physical symptoms?
That's where it gets really interesting.
Okay.
The source material emphasizes the potential for LCIG to improve not just those motor symptoms we typically associate with Parkinson's, but also the non-motor aspects of the disease.
Non-motor symptoms. Could you elaborate on that? I think most people, myself included, tend to focus on the tremors and stiffness when they think about Parkinson's.
You're absolutely right.
Yeah.
But Parkinson's is much more than just those visible movement issues. It can also affect things like sleep, mood, cognition, even bladder and bowel function. These are all considered non-motor symptoms, and they can significantly impact a person's quality of life.
It's a good reminder that Parkinson's is a complex disease with a wide range of symptoms.
It is.
Some more visible than others.
Yeah.
So are you saying LCIG could potentially have a positive impact on these less talked about symptoms as well?
That's exactly what the research suggests. Wow. Studies have shown that LCIG can lead to improvements in sleep quality, reduce fatigue levels, alleviate urinary symptoms, help with gastrointestinal issues, and even address impulsive behaviors, which can sometimes be a side effect of Parkinson's medications. It's important to note that research on these non-motor benefits is ongoing, but the initial findings are very promising.
That's pretty amazing.
Yeah.
We're talking about a treatment that could potentially address a much broader spectrum of symptoms than initially thought.
We are.
It's like tackling the disease from multiple angles.
Precisely. And that's what makes LCIG such a game changer for many people with advanced Parkinson's. It offers a chance to regain control not just over their movements, but also over their lives, experiencing a better overall quality of life.
But of course, we have to balance that excitement with the realities we discussed earlier, the potential side effects, the lifestyle adjustments, the cost. It's all part of the equation.
Absolutely.
Right.
There's no denying that LCIG is a significant decision with both potential benefits and potential drawbacks.
Right. It requires careful consideration and open communication with your healthcare team to determine if it's the right fit for your individual needs and circumstances.
Speaking of cost, I'm curious to know how much this treatment actually sets people back.
Okay.
It sounds pretty high-tech, and I imagine it comes with a hefty price tag.
It's a valid concern, and the source material doesn't shy away from addressing the financial aspect.
Okay.
It mentions that the cost of LCIG treatment in Canada is about 166 Canadian dollars per day.
Right.
However, it also notes that private and public insurance plans typically cover a significant portion of the cost.
That's good news. But even with insurance coverage,
Yeah.
I imagine navigating the reimbursement process can be a headache.
You're right, it can be a bit daunting.
Yeah.
However, the manufacturer has a support program specifically designed to assist LCIG users in navigating the reimbursement process and maximizing their coverage. They offer personalized support to help alleviate some of that financial burden and stress. That's a huge relief. Knowing there's that level of support can make a big difference in making this treatment accessible to more people.
It can.
But let's not forget the emotional and social aspects we touched upon earlier.
Sure.
We heard about the patient who felt self-conscious about the pump.
Right.
How do people generally cope with those feelings?
It's important to remember that everyone's experience is unique.
Mm-hmm.
Some people adapt quickly to using LCIG and find ways to incorporate it seamlessly into their lives. Others might struggle with feeling different or worry about how others perceive them. There's no right or wrong way to feel, and those feelings are valid.
So it's about recognizing that there's an emotional adjustment period and that it's okay to have those feelings of uncertainty or self-consciousness.
Exactly. Open communication with loved ones and healthcare providers is crucial during this time. Having a strong support system in place can make a world of difference in navigating those challenges and finding ways to feel comfortable and confident with LCIG. It's like anything new in life. It takes time to adjust. And having people you trust to talk to can make that transition a lot smoother. But are there any other key takeaways our listeners should keep in mind as we wrap up this part of our deep dive?
One crucial point to remember is that LCIG is not a cure for Parkinson's disease. It's a treatment that can effectively manage symptoms and improve quality of life.
Right.
But it doesn't stop the progression of the disease.
So it's about managing the symptoms, not eliminating the disease itself.
Exactly.
Okay.
Another key takeaway is the importance of individualized care. What works for one person might not work for another.
Right.
And that's why close monitoring and communication with your healthcare team are essential.
Yeah.
They can help adjust your medication dosage, manage side effects, and address any concerns that arise along the way.
So it's about finding the right balance for each individual, taking into account their specific symptoms, their lifestyle, their preferences, and their overall health.
Exactly. It's a personalized approach.
Yeah. A partnership between you and your healthcare team to find what works best for you. And remember, you're not alone in this journey. There are countless resources available to support you every step of the way, from healthcare professionals to support groups to online communities where you can connect with others who understand what you're going through.
It's incredible to think about how much ground we've covered in this deep dive.
Yeah.
From the science behind LCIG
I know, right?
to the personal stories of those living with it.
Yeah, we've really gone from the nuts and bolts of how it works to the very real impact it can have on people's lives.
And I think what strikes me most is the transformative potential of this treatment for people with advanced Parkinson's.
Right. It's not a cure, of course.
Right.
And it comes with its own set of considerations, as we've discussed.
Yeah, but the possibility of reclaiming those lost hours,
Right.
feeling more like yourself,
Yeah.
engaging in life more fully, that's incredibly powerful.
It really highlights the need for thoughtful and informed decision-making, weighing those potential benefits against the challenges.
And that's what this deep dive is all about, isn't it?
Yeah.
Equipping our listener with the knowledge to have those crucial conversations with their loved ones and their healthcare team.
It's about giving them the tools to explore whether LCIG aligns with their values and priorities, what matters most to them in this stage of their journey.
The document we've been discussing actually provides some really helpful prompts to guide that reflection.
Oh, cool.
It encourages people to consider which aspects of their lives are most impacted by Parkinson's.
Like what?
Is it mobility mood, the ability to connect with loved ones, or participate in activities that bring joy?
Right.
And how much are they willing to adjust their lifestyle to potentially improve those areas? It's a deeply personal question with no right or wrong answer.
Absolutely. And that's what I find so fascinating about this approach. It's not about dictating a course of action.
Yeah.
It's about empowering individuals to make informed choices that align with their own unique needs and goals.
Having this information, hearing these different perspectives, it opens up a world of possibilities and helps you navigate those choices with a greater sense of clarity and confidence.
Definitely.
So as we wrap up this deep dive,
Yeah.
I'm left with this thought. If you could significantly reduce those off periods, reclaim those precious hours of your day, but it meant carrying a device and making some lifestyle adjustments, would you consider LCIG?
That's a good question.
It's a powerful question to ponder, to discuss with your medical team, to explore further.
Because ultimately, this deep dive is just the beginning of your journey toward a more informed and empowered approach to managing advanced Parkinson's disease.
Thank you for joining us on this exploration. We hope it sparked your curiosity and giving you a new perspective on the possibilities of treatment.
Remember, knowledge is power, and the more you know, the better equipped you are to make decisions that align with your goals and values.
Until next time, keep diving deep.